I know we don't. We talked a lot up there. All right. This is Bruce McCarthy. I'm from Partnering with Consumers in Townsville. I'd like to ask a question really about what are you doing to engage young men? We've got girls' stuff up there. We've heard a lot about girls' stuff. And yet 75% of all suicides in Australia are young men between 15 and 44. I know, and one of the reasons I'm here was when my own son had something wrong in the A&E. Young men and men in general are not engaged very well by any of the health professionals. And young men don't go through 6 or 7 attempts to flipping kill themselves. They just do it. So I'd like to hear from the panel, what are you doing for young men? Because this city really needs help. My son has lost 7 of his peer group from Iggy Park, and he's only gone in 4 years. There's another 5 lads that were involved with one of those guys that have also committed suicide. Last week we had another guy from Iggy die, a year younger than my son, and there's a guy from 3RAR. What are we doing for men?
So thanks very much for raising. I think it's actually a very important issue. And just to say that this work around what we're doing for young people is for men and women. It's not just female focused, so please be clear about that. We do recognise the issues for young men. We do recognise the risk and vulnerability around suicide. We actually have a number of particular projects around there's a Ministerial Suicide Intervention Task Force. We're actually doing a lot of work with local communities. We've put in more resources in emergency departments, in training to do that work. We're actually consulting with communities around what should be done. I think there's a couple of important points to really make. One is that, yes, the suicide rate in Queensland is actually increasing, okay? So if we think about it, there was a crisis in young people suicide in the late 90s. We did some work, that came down. It's quite clear in the last couple of years that the suicide rate is increasing. That's of serious concern to us all, right? So we need to take that very seriously. And it's not, young men and young women do contribute to that, but it's also across the age ranges as well. So we really need to take suicide very seriously. I'm happy to talk with you offline and talk a bit more about some of the initiatives and things that we do and put you in contact with the right people. But that would be a great topic to talk about and, you know, in a further forum as well.
Yeah, I think there definitely have been quite a few hard to engage groups. Young men have definitely been one of those. We have had...
Sorry. Young men try to get help, and health professionals see them as fit and okay and send them on. They're not difficult to engage, you just need to find and listen to them and give them time to speak. It's not giving them time to speak. I know as a man myself, I now have a woman GP because the guy professionals, I'd go in, I'd spend 5 minutes, they'd give me a prescription and I'd go and I'd have a bill, and that's the only reason I knew I was at the doctor. We've got to train doctors to engage men.
Absolutely. Any other questions from the audience this morning?
Hello, my name's Di Friday. I'm on the Minister's Task Force for Suicide Prevention in Queensland, and I'm just wondering if this group have actually linked in with them, with their lived experience and tapped into their funding, because just to identify and address these gaps and these barriers. And I'm with Brother here because the young men and the Indigenous population, certainly needs to be addressed. So I'm just wondering, have you tapped into that?
I'm really happy to provide also extra information about this project because it's important to understand that it has come from a commission of inquiry where there were 6 very clear recommendations about what had to be done around this particular issue, which is not to say that it doesn't highlight that there are much broader issues around mental health that we actually need to address. But this particular project has a very clear outline, I guess. So I'm really happy to share that information with anybody after the session today. Just come find me. I think we probably have time for one more question and then we'll wrap up. Sorry.
Janine, I think one of the most important things about this Barrett Commission and then the working group that's arisen out of it was the work done by the parents on the Facebook, lobbying, finding people, connecting to people, and just telling their stories through that. I got hooked up somehow early on in the piece, and I was able to use my contacts to lobby people and get the commission sort of going, and it's very much...
Hey, yo.
Don't know what I did then. But it was very much, seemed to me that the whole process came through consumers, parents, children who had committed suicide after the closure of Barrett, really taking it out there to the community and causing a community upswell to lobby politicians and people across the department. Now, I'm hearing what people are saying about other issues here, and I wonder how you feel about them also perhaps using a similar sort of tool.
Hello. Thanks, Kevin. I completely acknowledge the gentleman's questions back there, and I guess I see as a platform and a starting point. And we had a very specific issue related to a very specific facility, and the Commission of Inquiry was the response to investigate why it closed down. There then came a very set of specific recommendations that we needed that the government said they would respond to, and there's a whole range of them, and one of them is including a transition from youth to adult services. But I guess the point I was making earlier about having access to the executive level of Queensland Health and other departments, I really see this project probably not coming to an end, but really just being a starting point. And it's going to give a platform to the pursuit of a range of other issues. And one of those in particular, since we are in a regional area, I live in Brisbane, Kathy lives in Brisbane, but in what seems like a past life, I've lived in regional and remote Queensland, and very high on our agenda is how the facility and the skills at that facility are going to be able to help support and address regional and rural issues. And I guess what I would like to see happen is that this is a starting point, it's a platform, and now that we're close to having addressed those specific recommendations, it's how we then build on that and start linking, as I said before, that this facility is part of a bigger system, and it's not ultimately going to be just about this facility. That was one recommendation from the inquiry. And I guess, we started off as parents just trying to do the right thing by our children. And through that, lobbying and advocacy, I guess, and the commitment of government, we've been able to get to this point now. This is the point where we start linking into all of those other issues and seeing how this work can then build on and link into all of those other issues, such as people have raised this morning. So it's certainly not the end. This is a starting point, and I can't speak on behalf of Kathy, but I'm in for the long haul, and I see this as a real opportunity to bring a whole range of issues to the forefront to see how they are going to be addressed, not just by the facility in this recommendation, but by those reforms and improvements across all systems, education and health, and any of the others, and that's not to exclude justice, housing. Young people have all sorts of issues. They don't know departmental boundaries, and I guess we're very cognisant of the fact that from here on in we need to be looking at how this work integrates into all of those other issues for the young people in our communities.
So just one last question to the panel. If you could give us one word to sum up your experience of being involved so far. can go down the line.
For me, it's eye-opening.
I have difficulty in making decisions on things like that where I have to pick one, but for me it's possibilities.
Improvement.
It's how we should be.
Mine's collaborative empowerment, and I'm just going to explain that briefly why. Collaboration for this has been, and we talked a little bit this morning about equality, it has absolutely been everyone at the table having an equal voice, which I think has been really empowering. But the empowerment for me comes with the possibilities of the future and the possibilities that this can be and will be a world-class facility, and that Queensland in a joint, a joint facility across ownership of that comes from not only Health and the Department of Education, but it also comes from parents and students that will use the facility. And so for me, it's collaborative empowerment of the futuristic view of what our students will need.
Could you join me in thanking our panel this morning?